Okay, so welcome to this presentation on documentation in caregiving as a caregiver. The onus is on you to write every single activity or procedure performed on your patient. If it's not written, it's assumed that it wasn't done. So, by way of introduction, recording and reporting information about a patient is an important part of your job as a caregiver. It's important that you understand the types of information that should be included in your patient's reports. Information included in your report should be facts, not assumptions, not stories, should be facts that you can establish. Objective information is based on information that you can actually see, that you can hear, that you can touch, that you can smell. So what did you see on the patient's body? You saw blisters, not assumptions, or you saw bruises. And objective information would include actions that you've also performed. Maybe you baited the patient, or you did 2-hourly toning, or the patient was fed, or the patient had a change of wound dressing done. The care you provided, measurements that is done could be the urine input and output, the amount of food that your patient consumed, or the fluid that was taken, and like I said, urine that was voided, the quantity that was voided. So these type of informations are facts. Those are called objective information. Subjective information are information in which you did not see, hear, touch, or smell. So they're not facts that can be proven. So that includes statements that the patient made to the caregiver about how they feel. So the patient says, I am sad. You can't touch sadness. You can see the facial expression. But by the time you report such, the caregiver is not there to see the facial expression of such patient. So what your patient tells you about what they feel or what they are thinking, you cannot see the patient's thoughts. You cannot hear their thoughts, you can only hear their words. So when you're recording subjective statement, you should try to include what the patient said using direct quote. So you want to put quotations on your patients on such a report. So my patient reported feeling sad, quotation on such, because they are subjective, they're not objective information. Now, it's important to use your senses as a caregiver because you will need all your senses to be intact and brought to the play to make observations about your patient and their conditions. Does the patient look shabbily dressed? Does the patient look grumpy? Does the patient look semi-conscious or a bit distracted? Does the patient look delirious? Your whole sense has to be there, not just carrying on robotic activities. Now, your report would include observations that you made by using your senses of sight, your senses of hearing. What did you hear? What could you touch? What could you feel? What would you palpate on a patient? And what did you smell? Does the patient have an alcoholic breath? For a patient who was known to be an alcoholic and then goes out drinking before you came to do your caregiving duty, what did you observe that can be incorporated in your objective or your subjective report? Now, sight. The use of your sight will include observations that you make using your vision. That would include your patient's condition as you work with them. That could include changes in your patient's appearance, your patient's skin, perhaps the legs are swollen, maybe they have weakness while they are ambulating, maybe they have a new bruise or a new rash, or their hands were trembling while they were holding the fork, or maybe the facial expression is different from the last one you observed when you cared for the patient. And you may also notice things in the home, such as there's lack of food in the house, clean clothing for your patient to wear. These are all observations that you make through using your sense of sight. Now, hearing, the use of your hearing is just as important as the sense of sight as you care for your patient, because you'll be listening to your patient as they converse. Is there clarity in what they are saying? Is there coherence in what they are saying? Are they losing track of their thoughts? You may notice changes in your patient's tone of voice. You may notice changes in the ability to use speech. Like a patient who is having stroke, that may be the first index of suspicion you have to be able to pick, to be able to give such a patient the prompt and medical care they would need. The rate of respiration, the way your patient is breathing, is it fast? Is it shallow? Then is this patient coughing or gasping for breath? You may hear your patient sighing, often to indicate that they are tired or they are sad. These are all observations that you will make through the use of your sense of hearing. Now, touch. The use of your touch is, you will use it all the time as you provide hands-on care for your patients. And that will include noticing the temperature of your patient's skin, hot or cold, feeling for moisture if your patient has spilled a cup of tea or is sweating, or if your patient has peed on himself or herself, or your patient's diaper is soiled. Then you would also use your sense of touch when you're testing for bath water or bottle for feeding a baby in case you are a caregiver to a baby or an infant. Then your sense of touch will be brought to play when you touch the rough edges of your patient's nail, indicating that the nails need to be filed because they can cut themselves with it, or wrinkles or moisture on your patient's linen, indicating that the linens need to be changed. Your sense of touch will also allow you to make observations about your patient's health and help you to properly care for such a patient. So what are the information that you would document while caring for your patient? That would include verbal or written reports that is important and pertinent to the situation on ground or the situation of your client. You want to avoid things such as your own personal thoughts about the patient. Those are not things for documentation. You want to avoid including your personal opinion about the patient or their health. You may want to chip that into your supervisor, but those should not be documented. You want to avoid including things like, I think the patient's heart failure is worse because she's more short of breath than usual. You want to state your own clinical observation. My patient was short of breath. If you counted the respiratory, you want to include the facts of the numbers of respiratory you counted, not the opinions that you assumed that may be wrong or may be right. You want to only record, like I said earlier, that patient has increased respiratory rate or patient has shortness of breath. You may also want to report something like your patient was observed to have shortness of breath while eating her dinner. Then you want to be careful not to use non-judgmental statements like Mrs. Smith was very rude to me today. You don't need to include every detail about the patient or about the visit. For example, it's not necessary to state that you spoke about a favorite television show or that your patient ate soup for lunch, unless the care plan directly and expressly states that such should be included, like what your patient ate. So in most instances, you only need to state a percentage of what the patient ate if the patient's meal is being documented. And many times it will be in volumes or in grams for a more objective assessment. So documentation is an important part of your job. It's important that you maintain current and timely documentation of tasks as they are completed and as your patient's condition improves or worsens. It is also the way that all members of the healthcare team will be able to communicate and become aware of potential problems or changes in the patient's conditions. Because the healthcare team, when the managing physician comes and does a home visit on your client, he or she will document. If the nurse practitioner comes, he or she will document. You as a caregiver also need to make your own note so that everybody is kept abreast of the latest development of the patient. So documentation will protect you and the agency against undue liability, because I said earlier, if it's not written, it's assumed that it wasn't done. So your patient's record is a legal document that can be used in a court of law. And it's also necessary to have accurate and timely documentation for patients that use insurance and even for billing purposes too. So you want to document immediately after your procedure, after your visit. Then it's important that you keep track of as many observations as possible and you complete them as soon as possible, because the longer you wait to document, the chances are you will not be able to give a succinct, a detailed documentation as required. Because you may see more than one patient per day if it's such that you do a number of hours in each home or with each patient. So as you give your caregiving duties to a particular patient, you document in such a patient's record. So if you document immediately after your visit, you have better accuracy of information, not that hours later you're trying to rack your brain to remember what you did for Mrs. John and what you did for Mr. James. Now, if it's not documented, it did not happen. So know that if something was not documented for legal purposes, it did not happen. If you care for a patient for 2 hours, but you forgot to document that you did so in the patient's chart, it's assumed that you never cared for that patient that day. So that being said, too, it's also important you don't document prior to actually providing the care. Don't document patient bedbaited before you did the bedbaiting. Don't document that patient had dental care done before you do it. That's called falsifying documents. When you're done with the procedure and you've offered the bedbaiting and you've done the oral toileting or the dental care, then you can go ahead and do the documentation. So how do you complete documentation for your patient? If you use ink and paper, you want to use black ink or a blue ink. If you use computer in your agency, you want to use computer to document. And this is usually dependent on your employer's requirements. Now, if you make an error, don't use Tempo, this white eraser that cleans. Medical documents are not supposed to be erased like that. You just draw a single line through such that anybody can see what the error was. And you put your initials and the date next to the error. Then you go down and write the correct information. It's only when you type document you have the privilege of deleting, but once it's handwritten, please do not use a Tipex, Tipex or Tempo to remove the error. Just place a single line through, put your initials, maybe J-O or Janet Ojo, and you put the date that is next to the error. Then when your documentation is complete, you should sign it with your full name and your title. So that could be a signature, then caregiver Janet Ojo, as I said earlier. Now, all documentations should be dated and timed. Depending on your agency, regular or military time may be used. So if it's regular time that is being used, it will indicate whether the time is AM or PM. If it's military time that is being used, it will be expressed as 000 hours for 12 midnight. So, for example, 1 AM, the time will be expressed as 0100. After 1 PM until 11:59 PM, 12 is added to the regular time. This may be complex, but chances are wherever you work, they would employ the more common method of AM and PM. I just need to chip this in. Should you work in a place where military time is employed? So confidentiality, remember to always keep all information in the patient's chart confidential. It's illegal to disclose information in the patient's chart without the patient's prior consent. The only people you disclose such to are members of the healthcare team, the managing physician, the nurse practitioners, the social worker, and the others. Now, your employer will provide you with specific training and information about the types of information that you would be required to record in your site visit report. So whoever you work with usually would inform you, okay, so when you go site visiting with your client or with your patient, these are the information we would need you to record, and this is the format we adopt, AM or PM or the military time. So now this is a sample documentation employing the military timing. So at 9 AM on the date that is indicated, which is the 30th of October 2014, this patient or your patient, of course, the name will be indicated, the card number will be indicated in the patient's documentation. The patient had assisting with feeding. Then by 9:30 AM, you provided bed bathing with oral care. By 10 AM, you assisted the patient with dressing. By 10:15 AM, you changed the patient's bed linens and you cleaned the bedroom. In total, you spent 1.5 hours with your patient. Your name and your initials is written, and your signature is also imputed into the documentation. And then you can go ahead to the next patient you have, do your caregiving duty, and on it goes. All right. So with that, we come to the end of this presentation. And as always, thank you for staying with me. I wish you a wonderful evening. Bye.